Hello, everybody. This here is going to be a video giving kind of a more refined and three-dimensional coverage of cardiovascular disease, a coronary artery disease, heart disease. This is what a heart attack is. And this is on this A side here, this is someone who is at very high risk for a heart attack in the late stages of plaque development with the narrow arteries. And your whole body has arteries, so this narrowing can happen anywhere. And if this blockage, if a piece of plaque lodges into that narrow opening, that causes a heart attack. If it happens in the brain, this is what is a stroke. And so coronary artery disease, cardiovascular disease is the number one cause of mortality in our country. And so this is something that a lot of people, you might know someone who has this or has this developing. And the good news is the B side, which is the 5-year follow-up, the reversal, the visually observed reversal of the leading cause of mortality in our country. This is a wide artery. The whole body now has wide arteries because of this. And this I wanted to cover because this little presentation here should give a more... Personally, I believe if you can visualize it, I'm a visual learner, so I learn visually. When I can see things, I can get a better idea of it, understand it better in my brain. So this here is a side view of the reversal of the heart disease. And then on the B side here, you have the 5 years. So you're healing, getting better. And then you stay with wide arteries. They don't regress back to being narrow. Your arteries stay wide. So that allows for the best blood flow throughout your whole body. And so this is the side view of it. And so if I slide to the next one here, this is a top-down view of that wide artery that is now healed. This is what it looks like. This is a cross-section, the top-down view, where there's no plaque. Nothing can break off and nothing can lodge in a narrowing. The only thing that's going to go through here is blood cells, platelets, plasma, all that stuff is all, there's no plaque buildup. This here is a visual that shows the building up of the arterial plaque underneath, which slows the blood cells down here. The hemoglobin gets stopped and it's not able to move through and carry oxygen to your body. It's just trickling through, and if something blocks there, then you would not get any stoppage, or you would get a complete stoppage of the blood flow and cut off the oxygen supply downstream. So this here is a top-down view of that narrow artery. That little hole is where all of the blood has to try to flow through in the artery, top down. And so it's going to increase the pressure of the flow going through there. And so this here is this is someone who ate plant foods one day, the day before they ate animal product, and this is what their blood looks like. When they spin it out, you can see this clear fluid here that you can see through. You can even see the name on the test tube. That's how clear this fluid is, yet on the animal side, it's cloudy. It's got saturated fat and cholesterol that clouds the blood, thickens it up, and makes it kind of sludgy. And that's not, good for blood. It's going to inhibit the blood flow and lay down layers of plaque little by little, but over decades it does add up. And there are babies being born right now with fatty streaks in their heart. So heart disease is forming where it used to kind of start forming maybe in people's 30s. Now it's forming in babies and then you would, after 3 decades, you could maybe potentially be at risk for a heart attack at 60. Now babies are being born with it, so they could potentially be heart attack risk at 30. And we can reverse it. We can prevent it for people who don't have narrow arteries. We can reverse it for people who do. So this is your plant fats, plant proteins. They don't cloud up your blood, thicken your blood. They keep it running smooth, keep the cells very slippery and flexible. And this here actually shows, this is when you have healthy arteries. your arteries are able to dilate and open up when they need to allow more oxygen to move with healthy arteries. But when they become inflamed, they get hard, they constrict, and so they are not able to expand. It stays constricted, excuse me, because of the stiffened walls of the cells. So you're gonna have to try to put all this blood through with where you would normally, when you're healthy, you have this wide opening. Now you have to try to put the same amount of blood cells through a narrow opening. It's going to be a lot more strain on your body, and you're also dealing with impaired cells at a cellular level. That's not good to have inflamed, stiffened cells. You want them to be cool. It's just like an engine. If you think of, like, you want an engine to be cool, running at an optimal temperature. If it runs hot, it's not a good thing. So then this here is just a little diagram showing like the inflammation along the lining of the artery, the endothelium, and then underneath it you have the cholesterol crystals that build up and turn into the plaque, the atherosclerotic plaque, and it shows the narrowing of the blood vessel, how it builds up, and you're going to shrink this the opening, the lumen. That opening is going to close over time as you get more buildup of the cholesterol on this right side here from underneath the lining. And then this here is a long-term kind of showing of the progression of the buildup of the plaque. So it goes from open to just a little bit, and it starts to get more and more and more and constrictive as more and more plaque builds up. So this is just kind of to show, and then this is just more facts about, I mean, it's a very serious thing that we can do something about this. We all probably know, unfortunately, some people who might have chest pain or joint pain, breathing complications, blood pressure, cholesterol, things like this, chest pain, the angina, or have actually had a cardio event, because this is very silent. Most of the time, people don't really know that they have narrow arteries, and then a piece of plaque can break off and just happen in an instant. It's very sudden, and we can actually get the reversal of it and widen the arteries so that there is no plaque that can lodge. So this is this post that I wanted to make. The Instagram is going to be, there we go. This is I'll do a few Instagram covers every once in a while of like several posts. This is one post that I made long, just to give kind of the most comprehensive breakdown that I could, kind of showing the side view, the top down view, and kind of what's going on, like an animation of what is going on in the body that causes the slowing. And we want our blood to be able to flow nice and easy when it needs to at rest, or when we need a lot of oxygen, like during an exercise or something. We want to be able to open the arteries up and let that blood really move through, and keep our blood clean and clear and fluid and viscous, and really able to move around and circulate well with the plant's products here. It keeps our blood clear. So it is reversible. The leading cause of mortality, that's a good thing. And so I am going to be doing a video here shortly as well. I actually have to think about a job. I know in my last video I talked about trying to do an eating thing for $10 a day, but I might have to bump that to 15 because of the inflation of food here, because like lentil noodles went up in cost. But I'm gonna do something with that, as long as if I settle on noodles or lentils or oats, but affordable eating that covers micronutrients in Chronometer. But that'll be another one. But the next video that I make here, I actually had something happen at school with my teacher, and they teacher didn't want me in class for asking a question about evolution, and it's kind of something. So once it settles out here, and hopefully I'm able to get into a class and try to get my full-time student status. Otherwise, I'll only take psychology, anatomy, and hopefully I can get into even an ethics class, a biomedical ethics, if not, or just regular ethics counts as well for the degree. But I'd like to get biology because it's a 5-credit class and the biology labs are fun. So I'm gonna make a video on that within the next couple days here, because I'll have to find out what my class schedule is because school starts on Tuesday. So that's this video about coronary artery disease, cardiovascular disease, what causes heart attack. So hopefully this helped any visual learners. But yeah, thank you for watching, and hopefully if anyone could benefit off this, or if you know anyone, just tell them yourself or show them or what do. This stuff has to circulate whenever we have, like, this is the type of information that everyone should know about. It should be well published out in all the media and everything, because this is what our nation suffers from, among other diseases, cancers, diabetes, dementia, things like that. But all those, this nutrition stuff really seems to take care of a lot of that stuff. And it really is biblical. I think our originally intended food source. And so getting something like this, think about in a way that's kind of, it's miraculous that our leading cause of mortality that we've been trying to develop through our man's intelligence, man's wisdom, pharmakia, we've been trying to find a way to deal with heart disease, and the nutrition that our creator Jesus provided for us is actually able to reverse heart disease or prevent it entirely from you ever even have to worry about having a heart attack, having heart disease, stiffened arteries, chest pain, things like that. It's really something, really, I think, fascinating. So if anyone can use this, do whatever. Get this to people, because we don't want our loved ones to be in pain, right? We want to get them out of hurt. So anyway, thank y'all for watching, for the time. And I'll make something here about what's going on with school. Because it's something, but I'll be able to do that through my computer. This is just something I wanted to quickly get out because school is starting, and with nursing and nutrition, this is something I want to really get to the forefront of. Thank you all for your time, and I hope you all are doing well. Jesus Christ be with you all.